How's your bladder feeling these days? I know it's weird to ask, but you need to consider the health of all organs, especially during these trying times. While the average age for people with bladder cancer is 55 and older, your bladder can still be unhealthy. Let's talk about 8 signs of an unhealthy bladder you can't ignore. Is it bad if I can't hold my urine? How about if I keep waking up to go to the bathroom? How serious is a change in color? Wait, can your urine smell? We're talking all that and more. Hey viewers, I'm Dr. Sophia Fahl and welcome to Lovers of Good Health channel. Before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. Number 1. Smelly urine. I know, gross isn't it? Well, it can't be more unpleasant than an unhealthy bladder. If your urine emits a foul odor every time you hit the toilet, this is a sign of a bad bladder. Your urine consists mostly of water, with some waste products mixed in. At least that's how it's supposed to be. If it's the other way round, meaning less water and more waste, your urine is going to smell like ammonia. Ammonia is a compound made of both nitrogen and hydrogen. It comes in the form of a colorless gas and can have a really powerful odor when released. Oftentimes, smelly urine can be the cause of a conflict between your gastrointestinal tract and the bladder. In long form, this condition is called gastrointestinal bladder fistula, but you probably won't be referring to it as that. Here's one condition you've probably heard of: urinary tract infection. This is when your bladder has become infected with bacteria. The next time you are in the bathroom, pay attention to whether or not there's an odor coming from your urine. If it's happening frequently, you'll want to get it checked out. Have you ever had an experience like this? How about an embarrassing bathroom experience? Sound off in the comments below and start a conversation with our Lovers of Good Health community. Number 2. Change in color of urine. I'm not talking about blood. Believe me, that's coming in a minute. This is something different. When your bladder is in trouble, you may see that the color is different. I'm talking about a darker tint. When you're hydrated, your urine will look much clearer. Urine that comes out dark yellow normally implies dehydration. The more water you're drinking, the more waste and toxins there are being flushed out of your system. If you haven't had any water, the built-up waste will come in the form of darker urine. If this is the case, drink more fluids. If it continues, there may be a problem with your bladder or kidneys. Number 3. Pain and burning during urination. If it burns while going, number 1, don't take this lightly. While burning during urination can mean several things, one of the most common causes is a urinary tract infection. A urinary tract infection is the result of too much bacteria within the urinary tract. This is the name for the body's drainage system consisting of your kidneys, ureters, urethra, and of course bladder. The urinary tract's role is to get rid of the urine, and it needs to be in good shape in order to do its job without hurting you. Your ureter tubes carry the urine from your kidneys to your bladder. If just one of these organs becomes inflamed for any reason, the urinary tract gets infected. This is what causes the burning or painful feeling when you urinate. Research shows that women are more likely to get urinary tract infections than men, due to things like pregnancy. If you are noticing frequent discomfort when hitting the bathroom, don't hesitate to talk to a doctor. Number 4. Waking up at night. We've all done it from time to time. It can actually be kind of funny. But if you find yourself waking up multiple times in the middle of the night just to use the toilet, your bladder is telling you something. This is called nocturia. While there are different degrees of nocturia, People with the severe kind can wake up as many as 6 times a night. This isn't something that happens from drinking too many beers the night before. Sure, nocturia may be a symptom of several health issues. But if a bad bladder is the cause, it's time to be alarmed. Constant nighttime urination could spell out a tumor in your bladder, or bladder prolapse. A prolapsed bladder happens when the protective, hammock-like tissue protecting a woman's bladder becomes weak and begins the drop. The rest is a little too graphic for us to discuss here, so I'm going to leave you to look it up for yourself. Nevertheless, if frequent urination has been interrupting your sleep lately, it's time to get your bladder checked. Number 5. Cloudy or bloody urine. Prepare to be grossed out, folks. Have you ever been going to the bathroom only to discover a strange cloudiness to your urine? If not, pray you never do. While it could mean mild dehydration, which can resolve itself through drinking more water, it's usually more serious than that. Cloudy urine can also be the result of blood or pus that has formed in the bladder. If you notice a reddish tint in your urine, this is called hematuria. I'll say again, this can result from several things. But a urinary tract infections is often one of the main culprits. Bacteria is gathering in the bladder and being flushed out through your urine. Blood or any kind of infectious waste can lead to a cloudy appearance. The thing that is so disturbing about blood in the urine is that it can be painless. Picture just going about your day not feeling anything, only to discover that your urine is murky and red. Pain or no pain, bloody urine is not normal. If you're experiencing this, you need to seek medical attention ASAP. Number 6. Fever. While it is rare, signs of a bad bladder can come in the form of a fever. Not a terrible one that keeps you in bed for days. I'm talking about a subtle, low-grade fever. Fevers can serve as another warning of a urinary tract infection. But it isn't just your bladder that is being affected. In this case, the infection has spread from the kidneys and into the bloodstream. While also rare, the fever can come with chills, nausea, and even vomiting. While I wouldn't really count on that, I guess it's not so mild after all. Number 7. Stomach and back pains. As you could imagine, a hurting bladder can cause pain in your stomach and mid-region. Unlike a fever, this symptom is actually pretty standard. People with bladder infections are likely to report feeling pain in the lower abdomen. This can range from light aches to unbearable pressure, the kind that distracts you from a task. People with an infected bladder have a tough time getting work done, since the pain takes up most of their time. You may also feel tension in your pelvic area, as well as the lower back. So how does this happen? Well, you know the discomfort you feel when you need to go. Number 1. This means that your bladder is full and must be emptied. Now just imagine that your bladder is unhealthy. When it fills up, that discomfort worsens and pain is felt in other parts of your lower region. If the need to empty your bladder is accompanied by stomach and AB pains, chances are the organ isn't doing well. Number 8. Urinating more than usual. As a child, your parents probably warned you that holding it in can hurt your bladder. I mean, sure, it's not good. But this doesn't mean you need to go to the bathroom every waking minute of the day. If you are running to relieve yourself more than usual, something is wrong. Most people urinate between 6 and 8 times a day. While frequent urination is often the sign of diabetes or pregnancy, prostate problems are also a factor. An enlarged prostate can press against your urethra. This will block the normal flow of urine into the bladder. As a result, the bladder becomes irritated and begins releasing what urine it has. This leads to you visiting the bathroom a lot more than you're used to. Do you suffer from an unhealthy bladder? Have you experienced any of these symptoms? Let us know in the comments below. We would love to hear from you. Thanks for your time, and see you on the next one. Don't forget to subscribe and like the video for more contents like this one. Bye for now.